Good evening, everyone. This is Veer Maheshwar Charitable Trust Latur, MS India, organizing daily international webinar series. This series is running from last 5 years, and the speakers are invited from India and abroad. The topics: education, law, health, environmental, technology, all are delivered here by our speakers invited every day on various topics. Today we have invited Ayushi Singh ma'am, who is Assistant Professor, Madhav University, Mount Abu, Rajasthan. And the topic is role of medicines in therapy and their adverse effects. I welcome you, ma'am, from my organization and from all the participants, those who are joined here. Our today's speaker is dedicated and enthusiastic in pharmacology research scholar at GD Goenka University with a strong passion for research and keen interest in the pharmacological studies. Her academic a solid foundation in pharmacological sciences, enabling her to contribute effectively to academic and industry setting. So her skill includes pharmacological research, laboratory techniques, data analysis, collaboration. She has successfully completed several research projects resulting in significant findings and contribution to the field of pharmacology. And we welcome you, ma'am. We are eager to listen from you on the topic role of medicines in therapy and their adverse effect on our health. Thank you, ma'am. You can start your speech now.
Thank you so much, sir, for this beautiful introduction. And I would really like to thanks to the Veer Maheshwari Charitable Trust and Dr. Betkar for giving me this opportunity to present and share my ideas and thoughts and also my research in with the all the public and all of you. So first of all, like I am going to present my PPT. So just a second.
I welcome all the participants, Dr. Kartika, Dr. Prashanti, Dr. Sanaj sir, Dr. Priti ma'am, Aditya sir, Dr. Harish sir, Rahul Mantri, Dr. M. M. Nandita, and all those who are joined here, Dr. Prashant. Yeah, your PPT is visible. You can continue. You can shift that spare box to other side so that it will not disturb. Yeah, thank you. Kindly unmute.
Yes, sir. So first of all, my today's topic of presentation is role of medicines in therapy and their adverse effect. So what was the objective of our learning today's topic? Like we are going to like I'm going to explain what is the role of medicines, like what is the role of medicines in modern healthcare and the therapeutic effect. The meaning of therapeutic means the drug, like all the medicines which are showing some effect, that is called the therapeutic effect. So how medicines work, and third is what is the side effects and adverse effects. ADRs means the drugs adverse effects. So I'm going to explain how the drugs are giving side effects and the adverse effects. And the fourth is safe and rational use. Like we are using lot of medicine, everyone is using and taking lot of medicines, but we all don't know, like no, everyone is not from the pharma field. So people mistakenly or uh, thought like some of the things, some of the strategies they thought they are taking the right medicine, or and they are taking in the right time, but that is only dilemma. So today, in today's session, I'm going to explain how medicines work and how we have to take this side effects seriously. So, first of all, I would like to explain what are medicines. Like everyone knows, medicines are chemical or biological compounds or substance which supports our health and manage disease. They also play an essential role in our healthcare because in today's era, in today's time, every people is having some of disease, some of like disorders or deficiency. So everyone is taking medicines, or somewhat afterwards, everyone is going to take the medicines. So in today's session, I am going to explain how the medicines are used, like for the prevention part, like how we can uh, prevent our disease from the medicines like vaccines, antibiotics. They are the medicine type of medicines which are used to prevent any disease. And for the diagnostic purpose, like for the diagnostic of some disease, there are medicines which are used to diagnose any disease. Okay, and third part is treatment. So for the treatment part, we are taking different type of medicines like antibiotics, antihypertensive, anti-cancer drugs. There are a lot of medicines which are taken for the treatment purpose. And fourth is symptom relief, like if we have any disease which are symptomatic, like we are having some symptoms, like we are having fever, we are having cold. So according to that symptoms, we are taking any medicines that is called symptomatic medicines. So medicines are classified in different types. All the medicines have their own different role. So now I'm going to explain you how this medicine works. It is a simple formula, what we can say that it is a simple thing, just like a lock key method. Like every drug or every medicine is not useful for every disease. Single medicine is used for single disease, just like a lock, a key is only useful for that same law, but not useful for another. Simple model we have in our medicines also, like we have drug molecule. Then that drug molecule is, when we are taking that molecule is goes into our body, and that identifies their target. Like molecule is identified by their target, and then drug molecule is attached to that target organ, and then they show their effect. And if a drug is showing a good effect, that is called their therapeutic effect. And if the drug is showing adverse reaction, like something different from good effect, that is called our adverse drug reaction. So today I am going to explain both the things. Like if we are taking a good medicine, that will recover the disease, and that is called the therapeutic effect of that drug or medicine. And if that the drug is not giving a good effect, that is giving a adverse effect or side effect, then that is called the bad effect of the drug. So medicines work by interacting different target molecules, just like I have explained in this series. Like drug molecule goes to target organ. We have different targets in our body system, in our whole body. And every drug, like if we are taking any headache medicine, how have you ever like think about this, that if we are taking a headache medicine, how it will only relieve our headache, because that drug molecule is basically formed in the way, chemically it is formed in the way that it can only binds or uh, goes on the same receptor of headache. So this is the, like, simply this is the way we are dealing with the drugs or medicines. That medicines are formed in this way and gives reaction in this way. So benefit. I would like to explain the benefits of medicines. See, as a pharma person, I'm not saying this like medicines are good for health, but it is somewhat important for everyone. It is not good for health because it is formed totally from chemicals, lot of chemicals, and if we are taking it from taking from for our body, it is relieving from disease, but it also gives side effects and adverse effects. But there is lots of benefits of medicines, like, that's why we are using medicines. So first benefit is like life expectancy. Like if we are suffering from different disease, so if we are taking medicine, we can have our lifespan long, like 47 to 73 we can live more life, because medicines can relieve any disease, and life expectancy get increases. It saves millions of lives, obviously, because we are having nowadays we are having lots of diseases. So we have lots of types of medicines we are dealing with. So it is, it basically it saves different lives. Many millions of lives are saved because of medicines. Smallpox cases, yeah, this is a major issue that like nowadays smallpox cases are zero. Not we cannot say zero because everything has positive and negative. So smallpox cases are now eradicated, not completely, but like 95% of cases are now eliminated, and polio cases are also eliminated because of the only vaccines and medicines. And the fourth is 100% quality of life. Like we have somewhat we have different types of chronic diseases. What I can say explain is chronic means the disease which are like very high chances of death and which are very risky. So, like cancer, uh, different type of cancers, and like different types of blood diseases, heart diseases. They are very serious problems, serious disease. But we also have different type of medicines which can manage our patients from maintaining daily life and quality life. So now understanding the side effects. See, everything has a good and bad effect. So as same similar, medicines also have a good effect and also have a bad effect. So good effect. Now, at previous slides, we are uh, having the good effects of medicines, and now we are going to understand what is the side effects of the drug. So anything which are not good for our body and not giving a good result is simply a side effect. They side effects occur because of the drug. Uh, if drug binds to different target molecule, or if drug is showing different from their physiology, then it is going to show a side effect. So it is an unintended effect which are uh, called as a side effect. And every medicine, if you see any medicine wrapper, you will see the indication or caution, and in that caution part you will see the side effects, like you, if you are taking this medicine, maybe this side effect will come. Like if you are taking a cough syrup, it is showing a caution that it will cause some sleepiness. Okay, so every drug has small side effects. So the risk benefit assessment, after every prescribing decision is the goal is always to maximize the therapeutic effect. Okay, so while the side effect occurs because the non-selective drug action and individual variability and polypharmacy. So drug action may be different uh, after we are having the drug in our body. Maybe it can cause variability, and to person, the side effects may be vary. Okay, and the common examples of side effect like nausea, you are feeling something little bit nauseatic when you are taking antibiotics. Drowsiness, you are feeling drowsiness, sleepiness when you take antihistaminic drugs. Antihistaminics like something like citrusin, levocitrusin type of drugs. You feel something drowsiness. So these are the common examples of side effects. Then side effects versus adverse effect. What now I'm going to explain what is the difference between adverse effect and side effects. See, I already tell you that everything has side effects, but if that same thing is giving an adverse effect, adverse means something worse. So if you are having adverse drug reaction, so just you have to simply just stop taking that type of medicine. If you are having a side effect, then it is okay because side effect is already known. But adverse effects, the main difference is this only that adverse effect is something bigger. Like you are unknown of that thing, and if that is happening, something different is happening, then just stop taking that medicine and first of all go to a doctor, and then after consulting toward that doctor, then only you start that medicine if you are having that adverse reaction. So first of all, what is the main thing? Side effect is unintended effect at normal dose, like something little bit drowsiness, little bit that nausea feeling, that is called side effect. And what is adverse effect? That harmful or unintended response to a drug. Okay, severity. If you are talking about severity, side effect have mild to moderate severity. Like it is not that much severe. Side effects are never be that much severe. But if you're talking about adverse drug reaction, it is very serious. Sometimes it is life threat. So, according to severity, drug reaction is more severe. And predictability, as we all know, we know all the drug side effect, but we don't know about the adverse effect of the drug. So, predictability is in adverse drug reaction, predictability is zero. Example, if I can relate with you from the example. So, if you are feeling drowsiness, feeling sleepiness, this is a simple side effect of a drug. And if you are taking any medicine and then you are feeling that anaphylaxis, like you are feeling somewhat reactions in your body, you are feeling having some adverse spots in your body, and feeling unhealthy by taking a medicine, that is in the area of adverse drug reaction. So major action, what we in side effect, we can just monitor or adjust the dose and then side effect reduce. And in the part of adverse drug reaction, if you are having any adverse drug reactions, so then simply just report to the doctor, discontinue the drug, and urgently treat that disease. Okay, and simply just stop. So first thing, just stop that medicine. Stop taking that medicine and simply go to a doctor. The like adverse drug reaction may be cause a severe effect. So please be aware of these things like side effect and adverse reaction is totally different. So if you are having not having any side effect, but you are having some different effect, so please see a doctor. Don't take it normal. And so common side effects by a drug. So these are some simple. I have put in these things simple, which drugs are taking normally in daily life. Like if you have ulcers in your mouth, you are taking that these type of drugs, NSAIDs drugs. So common side effects is this: you have like this is a side effect if you are taking ibuprofen, or if you are taking this fever medicine, paracetamol, and these painkillers. The some common side effects would be like, yeah, you are having ulcers or acidity type of thing. So what we to reduce the side effect, what doctors prescribe that take with food. After taking food, just take food first, then after taking that food, take that medicine, because it avoid the ulcers in your body, because it is little bit acidic. So if you are having before meal, that will cause more acidic reactions in your stomach. Then second is antibiotics. So when you are taking antibiotics, you feel nausea or diarrhea. So it is simply prescribed. Take some probiotics, the ghee or something like this to avoid this. Okay. Then antihistaminic, like you are taking any allergic, if you are having any allergy and you are taking any anti-allergic drug, so you feel something sleepiness or dry mouth. So after taking this medicine, please, it is given simply in the bottle or in the medicine tablet caution that when you are driving, don't take this medicine. Okay. And these corticosteroids, like steroidal drugs, when you are taking, then the common side effect is weight gain. So after taking this medicine, what is the significance that use lowest effective dose? Like if we are having this much of weight gain and hyperglycemia type of things, so reduce the amount and dose of the drug. And chemotherapy, everyone knows chemotherapy is simply treatment for cancer. And in cancer, they are having the common side effects like hair loss, bone marrow suspension. These type of things are common side effects. So for reducing this side effect, we have to monitor, requires closer monitoring. And if disease is reducing, then simply reduce the dose of drug. So to avoid the side effects. So now I will explain like safe use of medicines. What is the safe of use of medicines? Like rational or drug. Sub, first of all, we are having like read the medicine label. First of all, you have to read the medicine label, everything. Check the dose, frequency, expiry date, warnings before having a medicine. If you are having taking medicine, please follow these instructions. Like read all the label first, okay? Then follow dosage instruction. If it is written in the label that you have to take this medicine after the food, before the food, or before the bed, after the bed, please follow that instruction completely. Then after that, complete antibiotic course. If you are having any prescription of antibiotics, if you are having any antibiotic, then please do sure that you can't stop any antibiotic course before. Like if you are stopping and stop in between the course, you will not get relief from that disease, because antibiotic course is simply a thing that you are killing the biotics, like you are killing the bacteria or virus from the body. and it will take time to kill that bacteria. If doctor is prescribing like you have to take 3 days this antibiotic, and if you are stop after having 2 dose or 3 dose, then it will not completely kill that bacteria, and that half killed bacteria then grows in your body and cause a severe effect. So please don't stop from taking antibiotic in like half of the dose. Complete the antibiotic course and avoid drug interaction. What is drug interaction like? If it is mentioned that you have don't take food after having this medicine or don't take milk after having this medicine. So these are type of drug interaction. Drug interacts with that food or simply dairy products. So if it is prescribed in that manner, you should have to take that medicine in the same manner as being prescribed from the pharmacist or from the doctor. So what is the role of pharmacist as a medication? As I am also an assistant professor, but I am also a pharmacist because I have a pharmacy degree. So, what is the main role of pharmacist? First is medication counseling, preventing errors, pharmacovigilance, and patient education. Uh, See, the last point, what is the patient education? So the thing that same thing is I'm doing with you, interacting with you guys, that I'm educating you because I am a pharmacist. I know what the drug can do. So I'm giving the education to you guys who are not really aware, who are not totally aware of the every medication and side effects and adverse effects. So simply we have the pharmacists have the right to counsel every patient, prevent errors from like sometimes we are sometimes doctor just simply write the different medicine and people read that different name and having different things. So the role of pharmacist is to correct that medications and counsel the patient according to their dose and side effects, everything. So interactive case study, that like I have one case study, like we are taking a scenario like a 35-year-old patient presents with severe stomach pain after having self medication. Simply just a scenario that person is having stomach pain and he is self taking a medicine of ibuprofen 400 mg 3 times daily once a week. Okay, he is taking the same medicines for 1 week because he has his stomach pain. So taken an empty stomach without any medical advice. So see, this is the scenario, and this is the normal scenario which is happening in every like in around 100 house, every 10 to 15% of home people are having the same kind of scenarios, like they are self medicating, they are having self like they are having some little bit awareness about the drug, that this drug can heal my pain, so I'm taking this without any prescription, without asking to a pharmacist also. He or she is taking continuously. So what was the problem? That identify the pharmacological mechanism between the adverse outcome. If he or she is having this much of medicine without a prescription, there would be a severe adverse effect. Okay, how could it be prevented? How could it prevented? Like patients have to discuss with the pharmacist, discuss with the doctor. Then after discussing their problem, he or she should have the medicine. And what is the role of pharmacist here? Like Pharmacists have the responsibility to prevent, detect, and manage the patient's disease. Okay. So now I'm going to have discuss little bit myths and facts about the drugs. Like everyone thought antibiotics cure viral infection. Okay, like common cold. If you are having a common cold, people take antibiotics. But let me explain that antibiotics not to work against viral infection. Antibiotics can't able to kill any viral infection. It can only kill bacteria, not virus. If you feel better, you are stopping taking antibiotics. Like we all are having the same myth in our mind that we have the same myth that we are if we are feeling better, then you can stop the medicine. But as I explained earlier, antibiotics need time to cure. So please don't stop the medicine, stop taking medicine before the course. Herbal medicines also safe because they are natural. But this is also a myth because herbal products also have side effects. They are not totally safe that you are taking that medicine again and again. That will also cause severity. More medicine means more fast recovery. Some people thought that if you are taking more, like lot of medicines once, then he or she can get faster recovery. That is totally a myth because taking extra dose, extra drug can cause extra toxicity effect or harmful effect. And then sharing medicines with your family members is safe? No, because if doctor is prescribing you the medicine, that same medicine cannot get the good effects in different person because according to different person, doctors are prescribing different type of medicines. Okay, so test your medicine for safety knowledge. Like, can antibiotics treat? These are the normal, simple questions which I have put in this video for you guys to just simply understand. Okay, then can antibiotics treat common cold? No, which I have. The things I have like explained earlier. These are the all questions related to that. So this is my thank you slide. So before that, I have like fun fact, something in written in the lower part of the PPT, like one bonus question for you guys, for all the audience from my side. That if you could tell your family just one rule about taking medicine safely, what would it be? Like in this session, I have explained all the good effect of medicine, all the side effects of medicine, all the adverse effect of medicine, and all the myths also. So at the end, I have only one question. Like, what is the one thing what you can explain to your family members, to your friends, that this is the thing you don't have to take this type of medicine in this manner. So at the end, I'm going to like end this session with one quote: the right medicine at the right dose for the right patient at the right time is the foundation of self-help care. So please take the medicines seriously, not take lot of medicine to treat the disease just earlier. Don't take medicines normal because it can cause adverse effect. So take the right dose, take the right medicines, prescription medicines from the right time. So that's it from my side. So I welcome your all the questions which audience have.
Thank you, Ayushi ma'am, for your presentation, studies presentation today on medicine, side effect drugs. Right from what is medicine, what are its effects, what are its side effects, adverse effects, and how we can take care. All these things, basic things you have explained here, and this information is very much useful to us because every day we need to decide about the medicines from us from our family. So that is very important. I request all the participants they can unmute and they can discuss with our speaker on today's topic regarding drugs, reactions, and other related things. Thank you. Yes, sir. Dr. Swami Shukla, sir, it's your field. You can discuss.
Good evening, Dr. BETKAR sir. Namaste, Guruji. And good evening, madam. Thank you very much for your wonderful explanation and the very important message what everyone should carry. Please avoid self-medication. Let it be a very small thing. Paracetamol is a drug substance which is available in every house. So we have to be careful, how many paracetamol we can have, what kind of grams it should have, medicine. All these things, there is a science behind it. It is not just one tablet. So we have to consider this. And you have mentioned about antibiotics, especially. People develop, they abruptly they stop the antibiotics, and that is how they develop you'll find resistance to the drug substance. And whenever you are going for the same medication in the future, it doesn't work then. And then doctor has to find out sensitivity of yours for controlling your infection. So this is a very important fact. Then you have talked about very important thing, that is side effect and adverse effects and adverse event. So these are the very important things. Side effects, yes, definitely one can understand. Even a person illiterate also can understand. I'm getting, very simple word they are using, reaction aa gayi. So you'll find that word is there. But if it is acidity, if it is allergic manifestations, urticaria, then it is okay. But if it is a very, you'll find, if it is, you'll find that producing a life-threatening situation like anaphylactic shocks. So naturally, one has to rush to hospital only, not to the even OPD basis or clinic basis. So whenever there is an emergency, one should go for hospital because they will require hydrocot and all other aspects. And they have to, I had seen angioedema. So that these are the conditions, severe conditions, bronchospasms, and they may require the ICU setup also. So these are very important things what we are talking about. Always go through the side effects and always see the contraindications also, because the contraindications they have mentioned over there. So whether it is suitable for this age group or no, whether it is this remedy is very means it will work in pregnant woman or no. So one has to be very clear about this. And very important thing, expiry dates. Always check out for the expiry dates whenever you're purchasing medicines. So without prescription, please don't go. Nowadays, I've seen a trend, the people are calling from the home, doctor ko, abhi emergency, fever bachche ko, and give medicine. And the doctor is also prescribing. That is also very wrong. Because why is having fever, what complaints he is having, because the people are narrating and the doctor has to rely on those symptoms. So always check patients clinically. Examination is very important. And medications and vaccinations you have talked about. Vaccinations, vaccinosis is one of the very important conditions, which are the effects of the vaccines. So all these aspects, one has to be very, very important what you have talked about. And self-medication, please avoid. Take medicines with the prescriptions. Many people, maybe because of the financial this, they try to go for this. But I don't think, it is very rational thing what you are doing. You may threaten your life. I've seen cases of ecosprin, aspirin people are taking nowadays, so Disprin. So all these, they are the one category medicines. And if suppose they are taken by empty stomach, so naturally it produces, I had seen patient coming with hematemesis, that is blood in vomit, and severe loss of blood, and then you'll hypovolemia and leading to conditions. So very important medicines, let it may be a very smallest medicine, right? You feel that when it is there in front of you now and then, so you feel it is very common medicine, but don't consider any medicine common. Renal traumas, very important aspect I want to talk about. Then nowadays you'll find the renal failures, the renal traumas are so severe, and people are going for the dialysis, and literally they are losing their life. I've seen of taking some medication like ibuprofen or something for 7 days, 8 days, and all of a sudden there is a facial orbital edema, and then a diagnosis increase in serum creatinine, serum urea, and naturally, the patient landed into the means patient has to go for dialysis. So these are the acute renal traumas, and one has to be very clear about this. So whenever you are taking medicine, medicine का effect हो ना हो, side effect ना हो, yeah, that is a very important. Doctor when he is prescribing, he thinks about patient a lot. है ना, आप जो layman people है वो बिंदास खा लेते हैं कोई भी tablet, right, without much thinking. But doctor thinks much behind this, and he is there for your health. So going to doctor, taking prescription is the only thing. Madam, please focus on this, the renal traumas nowadays taking place, because I've seen patients, increasing number of patients for the dialysis. So please mention about this. Thank you.
Oh, thank you so much.
Can you say some word for this renal trauma?
Sorry, sir.
Can you
What
talk
you are
about
asking?
renal trauma?
Okay, renal trauma. Yes, sir. It is a severe condition in when there is injuries in renal part. Renal part is mainly kidney part. So if we have the different type of injuries due to that in the kidney part, so we have the blood in our urine, and different in the worst condition, kidney failed to work. So nowadays we are having lot of patients in related to renal trauma. So in this renal trauma, main thing is the side effect of medicine, because all the medicines are having the acidic reactions, and due to that whole stomach part and renal part is got disturbed, and this thing happens.
Yeah, so we are having a range of side effects, like gastritis is very common, and that is why doctor is always prescribing Pandy and all those antacids along with the heavy antibiotics or some other medications. Antibiotics we have said about, and you have mentioned about some steroidal therapies also. So sometimes the doctors prescribe prednisolone and dexamethasone, but on one side there is obesity, drug-induced obesity, and other side, you'll find very important is osteoporosis. That is what is happening, and that is what we can find out with, especially with the prednisolone. So thank you very much. Wonderfully placed. All the aspects. You are a associate professor, I think, and you are doing a.
Sir, now I'm assistant professor.
Assistant professor. Still, you are having a very great knowledge, and I think we should take a message from her that no self medications. That is the only thing what I can say. डॉक्टर को 500 रुपये देना परवडणार आहे, राईट. परंतु बेटकर सर, आपण जाऊन आपली गोळी खाल्ल्याने काही त्रास झाला, we have to get bed ridden, we have to get admitted, so we should not do this. Thank you very much.
Thank you, sir.
Thank you, Dr. Sanand Shukla, sir. Today it was your field, and we are hoping such a fruitful discussion, and we are enjoyed this discussion, and this is very useful for us also. Everyone, what should care, we should take care. मैं एक ट्राइबल एरिया में था, वहाँ एक बुक है सर लिखे वाली किन्वटचे दिवस। वहाँ एक डॉक्टर थे, तो उन्होंने एक लिखा है कि एक आदिवासी महिला है जो औषध लेके गई थी, मेडिसिन जो कुछ बोतल में, कुछ दिन के बाद वो बोतल रिकामी हो गई, बाद में दूसरी टैबलेट लिए थी तो वो उसमें डाल के फिर बाद में मेडिकल के पास वही बोतल लेके आई पुरानी, और इसमें कि मुझे गोलियां दे दो, और उसको इफेक्ट हो गया। उन्होंने ऐसे बुक में लिखा है। तो दिस इज वेरी केयर सेल्फ मेडिकेशन। एंड जब वो मेडिकल वाले जब हमें औषध देती है तो प्रिस्क्रिप्शन जो है वो राइट होना, वो बॉटल देखिए उन्होंने गलत मेडिसिन दिया था, ऐसे वो कहे थे बुक में। Thank you, sir, for your discussion today. Also, we enjoyed this one.
I had seen one case like what you are said, like right now, soframycin eye drop they have mentioned, and the chemist read soframycin only, right? He has given a tube, and they were putting that soframycin cream in the eye. So mishaps happens, that is a one thing. And one more point I just forgot, and that is Ayurvedic system of medicine. When we are talking about, they are also using gold, silver, mercury, and several toxic substances. So pharmacology, what subject she is teaching, is a really wonderful subject. It talks about there is a Harrison's pharmacology, and so many pharmacologies are there. There is a pharmacokinetic, pharmacodynamic actions, all those actions they are learning. And definitely this Ayurvedic medicine has to be searched for whether it can produce toxicity, because the therapeutic dose and toxic dose is very narrow in some cases. So and in India also we don't have that as per my weight I'm taking medicine, it is not so. We are having 500 mg paracetamol tablet, then 250 mg. There is no in between. But if you go to other countries, they are having different milligrams, grams. As per your weight, you have to take the medicines. Thank you.
Thank you, sir, for clarifying this one also aspect of Ayurveda, and they are using the mercury, gold, all these things. Thank you, sir. Now we are waiting for the Javeer Singh. Javeer Singh जी, आप बोल सकते हैं।
जी सभी को नमस्ते। नमस्ते मैडम। मैडम आपका प्रस्तुति बहुत ही अच्छी है, और आज की जरूरत तो है ही कि हमारे इस मंच पर वैसे तो कार्यक्रम एक से एक अच्छे आ रहे हैं, सभी सामाजिक हैं। मैडम मेरा ये सवाल है कि आज की भाग दौड़ में जैसे हम पानी जो ले रहे हैं उसमें कोई क्लोरीन की लिमिटेशन तो होती नहीं। जैसे मैं कारपोरेशन एरिया में देखता हूँ, कोई एक्सपर्ट तो उसमें क्लोरीन डालते नहीं, कि कर्मचारी छोटे रहते, कम लिखे पड़े रहते, तो क्लोरीन की कितनी मात्रा डाल रहे हैं तो इसका कोई अनुमान नहीं रहता। हम देखते हैं कि पूरा वाइट पानी होता है, क्लोरीन पाउडर आता है। तो ऐसे अगर हमें खाने की बात करें तो प्रिजर्वेटिव आजकल हर चीज़ में डाला ही जाता है, यानी केमिकल के बगैर कोई खाना फास्ट फूड सुरक्षित नहीं रहता। जब हम दवाई कोई बीमारी होती है, हम दवाई यूज करते हैं, उपयोग में लाते हैं, तो हम पानी का उपयोग करते हैं। एक तो ये क्लोरीन रहित जो सहित पानी है, इसके साथ जब हम मेडिसिन लेते हैं उसका क्या इफेक्ट पड़ता है। और जो हम जैसे हम बिस्किट खा के, घर की चीज़ें तो खाते नहीं कि भाई चलो बाहर है कुछ मार्केट से लिया खाया और उसके बाद दवाई ले लेते हैं, तो क्या इनका भी कुछ प्रभाव पड़ता है?
हाँ सर, वैसे तो हर चीज का एक इफेक्ट होता है बॉडी में, और पानी का तो मैं सच बताऊं तो मतलब ऐसा है कि लाइक हर रीजन टू रीजन ये चीज वेरी करती है। जैसे मैं अभी माउंट आबू में रह रही हूँ, मैं बिलोंग तो यूपी से करती हूँ, बट अभी माउंट आबू में हूँ। यहाँ के पानी में फ्लोराइड बहुत ज्यादा है। मैं किसी और रीजन में जाऊंगी, जैसे गुड़गांव से मैंने पढ़ाई करी है, तो वहाँ के पानी में एक अलग मतलब फ्लोराइड ज्यादा है, मतलब क्लोरीन ज्यादा है। तो हर जगह के रीजन के हिसाब से वहाँ के पानी में प्रॉब्लम तो होती है। और आपने जैसा कहा कि लाइक बिस्किट खा के या कुछ भी खा के हम मेडिसिन लेते हैं तो उसका भी इफेक्ट आता है, क्योंकि अगर जैसा मैंने बताया कि वो सारी मेडिसिन, ज्यादातर जो भी मेडिसिन होती है वो एक एसिडिटी कॉज करती है पेट में बहुत ज्यादा। इसीलिए कोई भी दवा देने के साथ में डॉक्टर उसको मतलब एसिड वाली दवा भी देते हैं, पेंटाप्राजोल या ये जो मेडिसिन देते हैं, ताकि आपके पेट में एसिडिटी कम हो और वो दवा पेट में जाने के बाद वो एसिडिटी ज्यादा ना बढ़ा पाए। तो ये बहुत जरूरी है कि अगर आप, जैसे आपने बताया कि आपके उधर पे पानी का ऐसा प्रॉब्लम है, तो कोशिश करिए कि वहां पे बोलिए कि आप आरओ का पानी मतलब ही पीजिए, क्योंकि पानी से भी आजकल बहुत सारी, सबसे मेन तो ये आपका टाइफॉइड ही है, ये पानी की वजह से ही फैलता है। और धीरे धीरे जो भी, जैसे आपकी तरफ क्लोरीन ज्यादा है तो उसकी वजह से बॉडी में वो क्लोरीन ज्यादा होने की वजह से एक नई बीमारी हो सकती है आपको, तो उसको अवॉइड करें जितना हो सकता है। और खाने का भी ऐसा है कि दवा लेने से पहले मतलब जितना अच्छा खाना आप खाएंगे, आधी आपकी बीमारियां वैसे ही ठीक हो जाएंगी। तो खाने पानी का ज्यादा ध्यान रखेंगे तो आपको मेडिसिन का ध्यान नहीं रखना पड़ेगा, वो लेनी नहीं पड़ेगी।
सही कहा मैडम, आज सावधानी हर चीज में बहुत जरूरी है। और जो फ्लोराइड की बात आपने की है, ये जो दिल्ली से एनसीआर चलता है, सोनीपत और यमुना का किनारा, जैसे मथुरा, गाजियाबाद, बागपत, शामली और हरिद्वार तक के इस क्षेत्र में इतना फ्लोराइड है। जो गांव में, जैसे मैं गांव से बाहर रहा तो मेरे दांत सुरक्षित है, लेकिन गांव में जो भी रहे माँ बाप सबके दांत खराब ही हो गए, मतलब या तो पीले पड़ जाते हैं, और उसका कोई भी सॉल्यूशन वहां आज तक नहीं निकला। इस बेल्ट में पूरे में फ्लोराइड है। ये बहुत सही बात कही आपने, और सावधानी बहुत जरूरी है। धन्यवाद मैडम, आपका कार्यक्रम बहुत ही अच्छा था, आपको बहुत बहुत धन्यवाद।
थैंक यू सो मच सर।
Sir, I want to
Yes, sir, please.
सर तो पूछ रहे थे कि क्लोरीन ज्यादा डालते हैं एंड वाटर बिकम्स वाइट। तो क्लोरीन इज अ हैलोजन, so it acts with the impurities, it kills the bacteria and all infective agents, and whatever remaining of chlorine is there, it get evaporated. So क्लोरीन का ज्यादा प्रभाव नहीं होगा। लेकिन आप जो फ्लोराइड बोल रहे हैं ना, वो दैट इज वेरी डिफरेंट थिंग। नाउ इफ यू गो टू आंध्र प्रदेश, नालगोंडा डिस्ट्रिक्ट, you will find the whole village, means near about 50% people are suffering with fluorosis, whereas there is a bending of knee joint and all those things. Nowadays there is also solution for removing fluorine, that is called as a defluoridation. So new plant has started at Andhra Pradesh, and they are removing the fluorine also. So we should be conscious about water intake also, and what constituents are there in the water also. Usually when it comes from the corporation, all tests, chemical, physical, biological tests are conducted, and then only water is released in the distribution system. Thank you.
थैंक यू सर। मगर वो अपने टूथपेस्ट में फ्लोराइड का यूज करते हैं तो उसका वो क्या इफेक्ट लेते हैं सर?
देखो, फ्लोरीन इज अ टू एज सोर्ड, दो दुधारी तलवार है। If it is deficient also, then also it produces caries, and if it is excess, it produces dental fluorosis as well as skeletal fluorosis. There is another term is called as genuvalgum. So both the ways, it is difficult. So it should be, I think, 1 milligram per day or something like that. It should be like this. If this fluorine is absent somewhere, these people can have this fluoride toothpaste. Nowadays fluoride toothpaste was not there. I think 10-15 years back I remember that fluorine toothpaste was also available, but nowadays it is not available. Once the science people realizes, they rectify, right? Nowadays yellow का white करने वाली पर्पल कलर की टूथपेस्ट भी आ गई है. So these are the very important things we have to learn. Thank you.
Thank you, sir. Thank you. It was a question in my mind regarding fluoride and toothpaste, so you have clarified all these things. Thank you, sir. सूर्य प्रकाश व्यास सर, आप कुछ बोलना चाहते हैं?
हाँ, नमस्कार सर। नमस्ते मैडम, आपका उद्बोधन बहुत अच्छा रहा। और मैं जोधपुर राजस्थान से बोल रहा हूँ। हमारा जो नेटिव गांव है, वहाँ पे क्या है कि फ्लोराइड की मात्रा ज्यादा है, जो जालोर डिस्ट्रिक्ट है। लेकिन वहाँ के लोगों का ऐसा कहना है कि अगर वो सादा पानी पीते हैं तो उनसे दांत पीले और खराब, इसलिए वहाँ पे है ना जो चाय का ज्यादा प्रचलन है। तो जो चाय और ज्यादा पीते हैं तो उनके कारण क्या पानी का वो साइड इफेक्ट उनका जो वो खत्म हो जाता है, और इसीलिए वो दिन में 15-20 भी चाय पीते, तो उनकी लॉन्ग लाइफ भी होती है। उससे पहले जो उनके दांत और उसके कारण और बहुत ज्यादा, तो उस स्थिति में वहाँ पे चाय ज्यादा पी जाती है, और वो जो चाय बॉडी के लिए ज्यादा अच्छी है बनिस्पत उस फ्लोराइड पानी। धन्यवाद मैडम।
धन्यवाद सूर्य प्रकाश सर। आज के रिसोर्स पर्सन भी आपके राज्य से है, माउंट आबू राजस्थान और आप भी राजस्थान से है, तो थैंक यू फॉर डिस्कसिंग विथ अस. You are daily joining participant, and from medical, not military college, he is joining here. So this group is very diverse. Yes, sir. This group is very diverse: arts, commerce, science, research scholars, medical, medicines.
एक मिनट सर, सॉरी टू डिस्टर्ब यू सर. इसी विश्वविद्यालय से एक सेमिनार हुआ था और उसमें मैंने पेपर भेजा था और वो पब्लिश भी हुआ था. उस हमारे कोई परिचित थे, वो वहाँ पे लेक्चर थे, इसीलिए धन्यवाद.
धन्यवाद सूर्य प्रकाश जी. और जो यहाँ आज मौजूद है, जेवीर सिंह जी, डॉक्टर सानंद शुक्ला सर, निम्बोदिता मैम, प्रीति कुमारी मैम, और जो यहाँ उपस्थित थे जिन्होंने इस व्याख्यान का भाग में सहभाग लिया और आनंद लिया. आज की इंफॉर्मेशन सबके लिए, हेल्थ के लिए बहुत ही अच्छी थी. हम केयर करेंगे आगे चल के कि कुछ मेडिसिन लेने के पहले डॉक्टर की सलाह लेंगे और हमें और हमारे कुटुंब के, फैमिली के सभी लोगों को इसके बारे में जानकारी देंगे. भविष्य में भी आयुषी मैम आप अलग टॉपिक पे भी यहाँ स्पीच दे सकते हैं. आपका बहुत बहुत धन्यवाद.
Thank you so much, sir.
Thank you, ma'am. You can leave now. Thank you.